Dr. Goyal, thank you so much for joining us, and thank you for all the work that you've done for the myositis community. I'd like to start by asking you what you're most excited about when we look at the future of not only myositis care, but the research that's happening for treatments.
Well, first of all, thank you so much. This is such a great event. It's just so wonderful to see patients and medical experts all come together and feel very passionate about moving the field forward. I think what we're most excited about as clinicians and scientists that really advocate for our patients are the drugs that are in line for trying to improve care, trying to reduce side effects of some of the drugs that are out there, steroids, for example. Great drug, terrible side effects. And so we have so many companies now that we're working and collaborating with that are really trying to help push the field forward. And I really see in the years to come that we're not only going to be curing the disease, but I look at a world from now where we're going to prevent the disease.
I love to hear that. I'd like to ask you specifically, we've talked a lot this weekend about women of color and some of the issues that they face when it comes to getting a diagnosis when they're looking at myositis. What are you seeing, and what are some of those bigger barriers that are coming up?
Yeah, I think it's unfortunate. I think, when we look at the past, we do see that there are these disparities amongst women of color. I think the fact that we've recognized it and we know that we need to do better in the healthcare field, I think that speaks volumes. And, we see it here at this meeting today. I think we've dedicated sessions for women of color. We are teaching women to feel empowered as a patient, a woman of color. I think they, in the past just didn't speak up for themselves. And you see that at this meeting. They're asking questions, they're learning how to feel empowered and that it's okay. And that us specialists in healthcare are recognizing that it's important to do this for our patients.
The self-advocacy part is so important, and something that I didn't think about, the rashes are something that is such an important part of the diagnostic criteria for different forms of myositis. And I never even thought that a woman of color who might have darker skin might have a harder time seeing those rashes or even noticing that they're there to begin with.
Absolutely. And we talked about that at this meeting, is that the rash looks different. And even the patient teaching the physician is okay. And it's something that is really important for the patient to understand that you can be an advocate for yourself, and it actually makes them feel empowered. And I think that's what the theme of this meeting has been this year is, really take this upon yourself to make sure you are advocating for yourself and making sure that you're working with a physician that appreciates that. And if it's not the right physician, it's okay to find someone else.
You're not hurting their feelings. I did have to learn that. It's a tough lesson to learn, but it's important.
Yeah, absolutely. Absolutely. And I think, it's finding the right team to work with, because we as a team is what's going to really push the field forward.
Well, thank you so much for joining us tonight.
My pleasure. Thank you for having us, and thank you for hosting a great event.
Thank you.
Thank you.